In the spring of 2020, during peak COVID hysteria, a nursing home in Bobcaygeon, Ontario had nearly half of their residents tragically die in a 2.5-week time period. All of the deaths were marked as COVID related. And undoubtedly, this worked to instill fear and terror into the general population, thinking that they were next. But did these seniors really die from this respiratory virus, or, as is now well documented and known, neglect? For Rebel News, I'm Tamara Ugolini, and in this report, I am going to give you a much-needed update on just what happened in at least one nursing home in Ontario that saw a massive amount of deaths in a short time span. Back in the early fall of 2020, I had been tipped off that certain things, like COVID-related deaths, didn't entirely make sense at Pinecrest Nursing Home in Bobcaygeon, Ontario. It was one of the first nursing homes to be hit with a COVID outbreak, and my colleague, David Menzies, went to do a field report and check out the scene at the nursing home in the early spring of 2020.
They don't want this to get out to the public. They want to try to bury it and make it go away, right? That it never happened and everybody will forget about it in a few months. That can't be the case. People need to be held accountable for what's happened. We've lost 29 seniors out of our community.
As a recap, I'll tell you that during the 2.5 weeks from roughly March 23rd to April 6th, almost half of the 65 residents at Pinecrest tragically passed away. It appears that due to a provincial policy, as per a Globe and Mail article, only 3 of these residents were tested for COVID-19 and everyone else was presumed or assumed to have it. The outbreak was declared on March 20th, and the very next day, on March 21st, Pinecrest Medical Director Michelle Snar emailed family members telling them to brace for the worst. 2 days later, after this email went out, nurse Sarah Gardner says that nobody showed up for the 3 p.m. to 11 p.m. shift on Monday, March 23rd. The remaining day shift staff had to stay to work a double. Staff was panicking. The article further notes that Pinecrest was perilously short of staff and references social media calls for help, where the community says that the small staff at Pinecrest is infected and working with a skeleton of staff, saying that they are in desperate need of help urgently. The article details a horrific death toll. 2 residents at Pinecrest Nursing Home died on Friday, followed by 7 more over the weekend. 7 residents dead, 7 seniors in 2 days. And shortly thereafter, the Ford government brought in the military to assist with the carnage that was happening in long-term care. And it's well known that the impact of the COVID-19 pandemic on residents of long-term care and seniors' homes has been severe, with approximately 81% of Canada's COVID-19 deaths in that first wave having occurred among the residents there. And based on the military report, we know now that these seniors suffered at the hands of horrific treatment from neglect, malnutrition, dehydration, the list goes on and on. Now, I was piecing together tidbits from mainstream sources, and I didn't want to rely exclusively on their reporting to try to figure out what happened at this nursing home. So naturally, I reached out to the home directly to ask. At the time, Janelle Wallen, she was an administrator at Pinecrest, responded that they cannot and will not disclose personal health information or any information that could potentially identify a resident or their family. But she confirms that they lost 28 residents to COVID-19. What she says next, though, is the most important. During the outbreak at Pinecrest Nursing Home, our leadership team had daily conversations with public health, the ministries of health and of long-term care, and other health system partners. But apparently the local health unit knew nothing of it. Look at this tidbit from the then Medical Officer of Health for HKPR. That's the Haliburton Kawartha Pine Ridge District Health Unit. Dr. Lynn Noseworthy, who was set to retire in 2020 and quietly did so after I started asking questions about Pinecrest. Dr. Noseworthy says in this article that she wasn't aware of this absolutely unprecedented death toll. And I quote, "We're always the last to find out. I'm serious. We're the last to find out." So, were they having daily conversations or not? And Lynn Noseworthy got a hefty raise in 2020. Why doesn't she know about this death toll? Because when I filed an access to information request, and that was made possible by your generous donations to our special exclusive reports website at rebelinvestigates.com, when I filed that request, it came back that no responsive records existed. The email noted that Sheila Bristol, the then Assistant Deputy Minister for Long-Term Care Operations Division, was responsible for that decision. Except that Pinecrest said that they had daily communications, and surely records had to exist somewhere. I mean, I had it in writing. So naturally, we appealed that decision and had to detail why. Finally, after nearly 2 years of investigative research, we have received a response that this documentation is going to be released. Jeff Butler, he's now the Assistant Deputy Minister for the Long-Term Care Operations Division, is responsible for this updated decision. I cannot wait to sift through and see what these records show. So please stay tuned for updates. For Rebel News, I'm Tamara Ugolini. This is the kind of investigative reporting that you won't find from the Justin Trudeau cheerleaders in the mainstream media. They parroted the hysteria instead of clamping down and questioning it, digging in to get to the bottom of nonsensical situations that came with great suffering and unfortunate loss. To help support me in bringing you the other, often unreported side of the story, please head to rebelinvestigates.com and chip in there if you're able to. It helps to ensure that we can keep following the facts wherever they may lead. That website again is rebelinvestigates.com. Thank you for your continued support.